So now we're going to look more at dispensing errors. So on average, for every 10,000 items dispensed, there are 22 near misses and 4 dispensing errors. Now near misses, that's when an error is identified and corrected before it actually reaches the patient. And a dispensing error is when the error actually reaches the patient. So a dispensing error could occur at least once or twice a month in every pharmacy in the UK. Okay, so let's really put it into context there that they can be quite frequent based on those statistics. Now, thinking about the implications of dispensing errors. On a patient, obviously patient safety may be compromised depending on the details of the specific error. The pharmacist also, now they could be subject to criminal prosecution, they could be subject to fitness to practice action, they could also be subject to disciplinary action by the NHS, and they can be sued by the patient. So there's loads of things really that a pharmacist needs to consider if they are involved in a dispensing error. So if we think about the types of errors, now this isn't a comprehensive list, it's not exhaustive, there are other ones. So these are just examples. We could have misreading of the prescription, we can have incorrect medicine selection, dispensing from the label and not from the prescription. Now that's just sometimes bad habit. You should always use the prescription as the reference. Transposing the label or labelling the medicine incorrectly, giving the wrong prescription to the wrong patient, or supplying contaminated or out-of-date stock. So that's just, as I said, just a few examples of the types of errors that can exist. Now, how can we reduce the risk of errors? So take this scenario, for example. You're a pharmacist manager of a local pharmacy. Now, the superintendent is concerned with the level of dispensing errors that's increasing in your pharmacy, and they ask you to identify actions to reduce this. So what can you do in answer to his query? So you could ensure that standing operating procedures for the supply of medicine are in place, they're regularly used, evaluated and reviewed. So we really want to make sure that the paperwork is up to date. You want to ensure that there isn't just one person as a sole dispenser and checker of the medicine. You want to make sure there's someone else's eyes are looking at this process. You want to ensure that medicines of similar sounding names or with similar packaging are not placed next to each other on the shelf. So you might have strategies of highlighting where those medicines that sound the same, look the same, might be put in different places, or they may be highlighted differently on shelves or drawers or wherever they're stored. Another way to reduce risk of errors by maintaining a medication error log. And what you would do is you monitor near misses. So if you can see that there are frequent near misses with a particular drug or drugs, then that will allow you to identify where there's specific issues, and you can start to look at addressing those issues. You might look at the work environment. So you might want to look at dispensary layout to see if you can reduce risk. It may be an issue around ability to concentrate, so that might be something that needs to be addressed. A workflow pattern, so in some pharmacies they may actually stipulate where certain aspects of dispensing can take place within the pharmacy. So on one bench that's where the accuracy check is done, on another bench that's where the labelling's done, etc. Dynamics of the team, so taking on board all the skills within the team. That may need to be considered in understanding where risk of error can lie. And if there are any personalities that are also contributing to errors. So maybe a conflict within the team may be contributing to a stressful environment, therefore increasing the possibility of error. Now, if a dispensing error does actually happen, there is something called the professional duty of candour. Now, this is where health professionals must be open and honest with patients when things go wrong. This means that you need to tell the patient when something has gone wrong. You should apologise to the patient and offer an appropriate remedy or support to put matters right. And you really need to explain to the patient the short and the long-term effects of what has happened. So you need to be really open with the patient. Well, patients may like to take the matter further. Okay, why might they like to do so? Well, the fact that the error has been made at a pharmacy, which many members of the public believe should work 100% accuracy, may be a reason why they think they need to take the matter further, because it proves that it isn't 100% accurate. Also, a patient may have been harmed by that error and therefore may want a further investigation, or a patient is just dissatisfied with the way in which the error was dealt with in the pharmacy. So maybe there wasn't a clear, transparent owning up of the error and explanation of how it happened, or any kind of effort to resolve anything really that happened. Now, if the patient takes the complaint further, doesn't mean that the pharmacist will be struck off. Not necessarily. The GPHC will determine if the error is of sufficiently serious nature to require referral to fitness to practice hearing. Now, the GPHC investigation process, they'll have an initial investigation, and that's carried out by the GPHC inspector. They will deem if a threshold criteria are met, and if it is, the cases are referred to an investigating committee. Now, the investigating committee can then refer to fitness to practice committee, and the fitness to practice committee can remove the pharmacist from the register. So it's quite a lot of investigations that need to be undertaken before a pharmacist will be struck off. Now, the criteria for referral of dispensing errors, cases not referred to the investigating committee unless they meet certain thresholds, and those are stipulated by the GPHC, and they are available on the GPHC website. Now, they really include that there's either moderate to severe harm, which was avoidable. There was a deliberate attempt to cause harm. There was failure to act when necessary to protect the safety of the patient. There are unsafe working practices, and also the pharmacist is unfit to practice safely. So if those aspects are met, then there is a referral of that error to the investigating committee. It's important to remember that until now, pharmacists are committing a criminal offence each time they make a dispensing error. And that's because there have been breaches of law. So Section 64 of the Medicines Act 1968, and then specifically Regulations 268, 269 and 270 of the Human Medicines Regulations 2012. Currently, all dispensing errors are considered as strict liability offences, and a criminal offence is committed even if the error itself is unintentional and regardless of the level of patient impact. Now, the majority of cases are brought under Section 64, and that stipulates that a person commits an offence under Section 64 if he or she, prejudiced to the purchaser, sells any medicinal product and that product is not of the nature or quality demanded by the purchaser or specified in the prescription. So basically anything outside of what was written on a prescription is breaking the law. Prosecutions are rare. Cases will be referred to the criminal justice system if there has been a death following an error, and gross negligence or manslaughter charges are being considered. There have only been 2 prosecutions that have fit these characteristics between 2007 and 2009. Now, the Crown Prosecution Service has guidelines to determine if a case should be brought to them. So take this one as an example. So we had a pharmacist, Elizabeth Lee, and in 2007, her case happened. Now, she's a locum pharmacist. She'd been qualified for 7 years, and she dispensed propranolol, which is a beta blocker, instead of prednisolone, which is a steroid, to a 72-year-old patient. Now, the product was prepared by an assistant and checked by Mrs. Lee. The label was for prednisolone, but it was stuck onto a box of propranolol, so the wrong medication was given out. Now, the patient took some of the propranolol and subsequently collapsed. She was hospitalised, but she did recover. She did later die in hospital, but that was from natural causes. So Mrs. Lee, she was charged under Section 85 of the Medicines Act. She did plead guilty. She was sentenced to 3 months imprisonment, suspended for 18 months, plus 12 months supervision order. On appeal, her offence was changed to being under Section 64, and the sentence was reduced to a fine of £300. Now, Mrs. Lee, she had no previous history of errors. She had an excellent work record and testimony. The prosecution and sentence was as the result of a single dispensing error. Later, Mrs. Lee resigned from the register, and so no action can be taken by the regulator until such time as she reapplies. So this is a hard-hitting story to make you think that you must do everything you can to reduce the risk of dispensing errors. And if they do occur, try to learn from them. Deal with them professionally and honestly. Now, in the future, will dispensing errors continue to be a criminal offence? Possibly not. There was a consultation by the Department of Health to look at the rebalancing of medicines legislation and pharmacy regulation. They potentially are looking to introduce a defence for dispensing errors, and any professional who deliberately sets out to harm patients would still face criminal prosecution. Inadvertent errors will be dealt through GPHC procedures, and if proposals are accepted, it is hoped that pharmacists will be less inhibited about reporting errors, which will enhance learning from those errors. The outcome of that consultation should have been out by the end of 2015, beginning of 2016, but we're still waiting to hear as to whether decriminalisation of dispensing errors is actually going to come to fruition. So what we've looked at in this videocast has been standard operating procedures, so looking how we can standardise all of the processes that are occurring within pharmacies, and looking at dispensing errors, so where something has gone wrong with a process, specifically around this.